Hello, I'm Dr. Sudha Tandon, gynec endoscopic surgeon and IVF consultant practicing at Mumbai and Navi Mumbai. Today, we'll talk very briefly of a very important point, that is low ovarian reserve. Now, it is seen that the number of women who come for fertility treatment is on the rise, and low ovarian reserve forms about 10 to 30% of the causes in these women. Women do have an expiry date of fertility. Their egg reserve definitely goes down because of age. Here we have a situation where a woman of 35 has an ovarian reserve which is lesser than her age. That means the number of eggs produced and the quality of eggs that are produced during treatment or naturally are affected. So these women, when on treatment, do not respond very well, or even the natural conception decreases. Girls, when they are born with about 5 lakhs to about millions of eggs in their ovaries. At the time of puberty, it goes down to 3 to 5 lakhs. And during her entire reproductive period, there are about 400 to 500 eggs which gets released during the time of ovulation. And for every time of ovulation, few follicles or few eggs die on their own. Now, when this egg reserve is less or the quality is affected, we call it as a low ovarian reserve. What are the causes? It could be a genetic cause, it could be a familial cause, it could be that she has undergone some surgery, especially surgery for endometriosis, either a cystectomy or a surgery which is for PCOS, which is a laparoscopic ovarian drilling. She could be an obese woman. Also, smoking is associated with low ovarian reserve. Poor lifestyle is associated with low ovarian reserve. Also, it could be an autoimmune disorder. It could also be that she has undergone some treatment for cancer in the form of chemotherapy or radiotherapy. So these are the important causes of low ovarian reserve. What are the tests that need to be done? A low AMH is often seen in women of low ovarian reserve. AMH is a test of the preantral and the antral follicle count, and this can be done during any time of the period cycle. Now, if it is low, it definitely suggests a low ovarian reserve. Similarly, a day 2 FSH or a day 3 FSH, which is normally up to 10, is normal. But if the day 2 or day 3 FSH is more than 15, then probably she has an early menopause and she has an low ovarian reserve. On sonography, the antral follicle count, that means the number of follicles which can become eggs or follicles which can grow in that cycle, that is also less. Normally we see that a woman has about 5 to 10 antral follicles in each of the ovaries when we see them on sonography. Now if it is less than 3, then her antral follicle count is less. Also the ovarian volume is less. Now these women have symptoms like the periods come very early, every 21 days or every 20 days, or they could have even menopausal symptoms. From fertility point of view, what is the treatment options for these women? Well, if you know that you suffer from a low ovarian reserve, if there is a familial history, then probably you should aim to get pregnant earlier. Or if you cannot get pregnant, you cannot plan a pregnancy, you can think of freezing of the eggs or embryos, so that if you want to get pregnant at 40, you will use eggs when you were 30. So this is one very good option one can think of in the form of social freezing of either of the eggs or of the embryos. There are other medicines which can be of benefit, like using antioxidants, using melatonin, using coenzyme. So these are few antioxidants which may improve. Then different protocols for stimulation during IVF can also be used. Higher doses of gonadotropins can be used to improve or to increase the egg yield during the IVF treatment cycle. If the eggs that we get during an IVF treatment is of lesser amount, we can pool the eggs or the embryos. That means you undergo 2 to 3 cycles of IVF to get those many eggs or embryos. Other adjuvants like using DHES for 4 to 6 months before a treatment cycle could be done. Even transdermal testosterone application is known to increase the egg yield in the subsequent cycle after the use of testosterone gel. Then one can also use growth hormone to increase the yield of the eggs. So these are few medical options that one can offer to women with low ovarian reserve. Other treatment options which are available are not really proven. They could be experimental, like use of a stem cell treatment, use of PRP injections into the ovary if the egg reserve is less. There have been instances, there have been cases where women have conceived either naturally or with treatment after the injection of PRP or stem cell into the ovary. I hope you found this video useful. Kindly comment in the comment box and do follow us on Instagram and Facebook. Thank you.